Hi, I'm Dr. Bhandarkar from Spine Center, Chesterfield, and today we're going to talk about MRI. So, MRI is very essential for patients while giving a diagnosis. It kind of gives the details of the patient's anatomy, their discs, their nerves, if there is a compression on that nerves or not. But does MRI tell you the entire story? MRI is just a picture. It's not a diagnosis. A lot of people kind of understand what they find on MRI as the diagnosis. So here are some things that I want to tell you guys. Number one point, there are a lot of people with a lot of changes on the MRI who do not have any symptoms. They are completely asymptomatic. To an extent, there was a study done where they did MRIs on people who had no problems or no symptoms, and they found out that about 50 years of age, 80% of people have disc degeneration. So it's a very common finding. So a lot of people who come to me with complaints of, hey, I have had an MRI and it shows disc bulges everywhere, should I be worried? My message to them is just don't worry. We're not going to end up treating the MRI. What we usually treat is the symptoms. So the essential thing that links those findings to the symptoms is what we know as clinico-radiological correlation. That is essential determining if you need any particular treatment or not. So let me explain that in more detail. So if there is a patient who comes with a shooting leg pain and he has the pain on the right side, and the disc that we see is on the left side at a different level. What does that mean? That means that his findings are not relating with his MRI picture. And what does that mean? That means we need to dig deeper. We need to find out what are the other reasons for his shooting leg pain. Is it something going on in the sciatic nerve? Is it something going on in his blood vessels? Is it something going on in terms of peripheral neuropathy? Needs to be found out. So that clinical radiological correlation, or putting it all together, is very important. And usually a surgeon is responsible for doing it, or any spine specialist is responsible for doing it. Without that, just treating an MRI or just treating a picture is not going to give you a good result. So with time, we have seen a lot of people being over-treated for their back findings from that MRI that they have done. And I think that is not needed, because there are a lot of asymptomatic patients with MRI findings, as we talked about. Also, sometimes people talk about sizes like, hey, my disc is 4 millimeter in size or 6 millimeter in size. Usually when it comes to that disc size, it doesn't correlate with symptoms. So a smaller disc can create more symptoms, and a bigger disc can be completely asymptomatic. So again, what is important here is to correlate clinically. So the patient comes to us, even with a small disc, but it is at the same location that we think clinically is correlating with his MRI, then that patient may require further investigation and treatment regarding that particular disc. Here, the injections come to a great help. So injections have a great value in further correlating those symptoms, because injections can evoke a response without burning too much bridges. So if a patient comes to me with a shooting leg pain, and if I do a epidural injection into the same disc area, into the same side, and the patient says my pain completely went away, I think those patients are almost confirmed patient of having the problem coming out of that particular disc, and those patients respond very well if they happen to get surgery, if the injections do not give them long-term pain relief. So again, to stress the importance of clinico-radiological correlation and how it determines in my practice how do I operate patients and how do I approach patients who require surgery, is very important concept to understand.